Hello everyone, my name is Fahimullah Sayyed. I'm a student of La Trobe University doing a master's in public health. My book review is on the book The Birth of the Clinic, an Archaeology of Medical Perception. This is Michael Foucault, who is the author of the book. He is a French historian and philosopher. The book was originally written in French in the year 1963, which was then translated to English in the year 1973 by A. M. Sheridan Smith. Michael Foucault has lectured in many universities, including those in Copenhagen, Oslo, Lisbon, Madrid, Istanbul, Naples, and Brussels. The Birth of the Clinic is a history of the medicine profession, medicine, and disease. Besides this, it is also a history of human experience and the experience of politics, bodies, and systems. By locating itself within all these frameworks, the birth of the clinic also becomes a critical history of looking at the history of public health in the world, the emergence of governmentality, regulated social spaces, and eventually self-regulated bodies. This is much a book about language, vision, and experience as it is about medicine. It also becomes a history of displacement, where disease is displaced from the body displaced from pain, and the individual displaced from the social to the pathological, and experience is displaced to the realm of language. The book basically emphasized on two parameters that plays an important role in the history of medicine: the medical gaze and the language. The act of looking or gazing by a doctor treats the patient as an object of knowledge. The body becomes an object of medical examination and knowledge. He constitutes disease and patient body as a single datum that contributes to our medical knowledge. Foucault says that the appearance of symptoms and signs of disease helps the doctor to see and say, that is, learn more about the disease through its symptoms and signs. Disease becomes subject to new rules of classification, and doctors begin to describe phenomena that remained invisible and inexpressible for many centuries. During the 18th century, for the first time, medicine underwent a mutation, and medical knowledge took on a precision that had formerly belonged only to mathematics. The book was written to help us understand why our healthcare system is both successful and dysfunctional as it is. There's a major challenge for the profession of medicine, as we seem to make the same mistakes that happened during the French Revolution. The book talks about the anarchy the medical world faced during the 17th and 18th century. He referred to the unskillful medical professionals as quacks, and they were responsible for many deaths of the patients owing to their inability to handle patients and provide effective medication. The government had no regulations in place to control this medical anarchy and failed to form an effective education system for medical professionals. The education system that medical professionals had was done through self-regulated bodies and without any government interventions. Unskillful yet famous medical professionals would give private lessons to pupils who want to make a career in medicine and would charge a fortune for that. Disease, when contracted by a poor man, becomes a burden not only on him but also his family, as the cost of bed and treatment is very high. Churches are used as a place for curing diseases and funded heavily, whereas no investment is established on providing proper hospitals which can act as learning centers for medical professionals. There was a case of an officer of health in the Creuse who killed his patients by administering purges of arsenic. The author says that for clinical experience to become possible as a form of knowledge, a reorganization of the hospital field, a new definition of the status of the patient in society, and the relationship between public assistance and medical experience, between help and knowledge becomes necessary. The author argues that the medical gaze plays an important role in curing the disease. He also emphasized on the need of proper medical practices, hospitals as teaching centers, and this should be supervised by the government to ensure proper establishment of public health governance. She is Sarovar Zaidi. She is a doctoral research fellow at Max Planck Institute with an affiliation of the University of Utrecht, Amsterdam. She is a social anthropologist. She mentions that the book teaches us about the hyper-governmentalized world and how to begin to cope with it. It also enlightens us about the present threats to the public health governance. This is Jean Starobinski. He is a Swiss literary critic. He says that the book is worth reading for people who are interested in the history of medical transformation and dissatisfied with the traditional procedures of intellectual history and would like to see historians of ideas rethink their objectives and methods. Although there are many positive reviews for the book and the author for his commendable work, I am not completely in agreement of the saying that if the poor man refused to offer himself as an object of instruction, he would be guilty of ingratitude because he would have enjoyed the advantages resulting from sociability without paying the tribute of gratitude. It's said that the poor man lying on the bed and battling with the malady may either cure or perish, but in both the instances, he enlightens the knowledge of the physician about the disease, which in turn would help in saving the lives of the affluent. A treatment should be pursued with an intent of curing the disease, irrespective of the status of the patient. I agree that gaining knowledge is associated with the treatment of a new disease, but the main intent should be curing the patient irrespective of whatever his status is in the society. Quacks practicing medicine is considered unethical and also devastating for public health perspective, as it could lead to severe losses of lives. It is the responsibility of the government to ensure that effective rules are in place which prohibits unskillful doctors from practicing. Though there are many advancements in medical field associated with cutting-edge technologies, but still the cases of medical negligence and death are rampant throughout the world. I'd like to give you a few examples of the present medical negligence cases. There's an example where a Philadelphian abortion doctor called Kermit Gosnell killed a patient and 7 babies during operation. There's another example where a 27-year-old lady called Nergis died due to medical negligence while undergoing an operation of sterilization in Shamili district, Uttar Pradesh, India. These are just a few examples, but there are many more examples of medical negligence out there in the medical world. More emphasis and governance should be laid on public health and effective surveillance of the hospitals and clinics to ensure that lives of the patients are not threatened. Thanks a lot for paying rapt attention towards the book review.